Now we're going to do the comprehensive orthopedic exam, and I have Bronson here to help me. If you've watched the OA screening video, we're going to incorporate everything that we did in the screening exam, but now we're going to dive a little bit deeper in terms of palpation of each limb and joint. Hugely important trick is having a pocket full of treats. This is going to be a must-have whenever you're doing any sort of exam. We always want to make sure that the dog doesn't have any allergies, so Bronson specifically needs some salmon treats. The first thing we're going to do is watch the dog walk. We're going to evaluate their gait, and I like to do this by actually meeting the client and the dog in the lobby and watching them walk back to the exam room. Then once we're in the exam room, I'll generally sit and talk to the client, obtain the history, and then just watch Bronson move around the exam room. We can scatter some treats, just watch his general movement patterns, and often I'll watch him move through different transitions, sit, stand, down, stand on his own when he doesn't think that I'm watching. But then I'm also going to ask him to do those transitions for me. So Bronson, I'm going to ask him to sit. Yes, good boy. And what I'm looking for with the sit is a nice symmetric square sit. If we don't see that, if we see the dog sitting off to one side, that's going to potentially indicate something in their knee or their ankle, their hock joint. But so we're specifically looking for symmetry. Bronson, come here, buddy. So we only observed part of the transition. So I want to watch him sit, and then I want to watch him stand. Here? Yes, good boy. So what I was just observing there was his movement from a down to a stand, and he did use both back legs. So from a sit to a stand. Here, here, here. Okay, you sat. Here. Okay, so he goes from a sit to a stand using both back legs pretty symmetrically. He's pushing off or thrusting off both back legs. And if we watch the down to stand again, down, down, good. So at first he's symmetric, but then he shifts his weight to one hip. That may or may not be significant, so I'll usually repeat that a few times. Okay, here. And then when he goes to stand, he pushed off with his pelvic limbs rather than sitting first, which indicates that he has enough strength in his back legs to do that. Very good. So now we're going to do the screening palpation with him standing. And I'm usually incorporating this into my general physical exam. So starting at the head, I'll be looking at, just cranial nerves, looking at mucous membrane colors, which is always going to be important with our golden retrievers. Likewise, feeling for his lymph nodes. Checking out his ears. And then I'm feeling for muscle symmetry in his temporal muscles. Then coming down to the neck. So we know that for forelimb lamenesses or thoracic limb lamenesses, we always want to rule out or make sure we're not dealing with a cervical disc herniation or something in the cervical spine and the axillary spine that could, from a neurologic standpoint, be causing pain that looks like orthopedic disease. I'm palpating along the cervical spine, feeling each transverse process of the cervical spine and also feeling for muscle symmetry. Now, once he's standing, I'm going to palpate, again, symmetry of his shoulder muscles. I'm feeling the scapular spine, and then running my hands over the muscles, down the front of his shoulder, and then over the elbows. And again, looking for any effusion. So effusion in the joints is going to be best palpated with the dogs in standing rather than lateral recumbency. So I'm palpating for effusion under the anconeus muscle on the lateral aspect. And then also feeling the medial aspect of the elbow for periarticular fibrosis. Dogs with arthritis of the elbow typically have a thickening of their elbow, and you feel it mostly on the medial aspect. Then running my hands down over the carpus, again feeling for any effusion down here. And then this is a nice time to work in a neurologic screening exam. So I'll test for proprioception. So in addition to proprioception, I'll also do hopping exam. And just part of our neuro screen. Excellent. So continue with standing. Good boy, Bronson. So, if he's getting a little bit tired, I'll often give them a little break, ask the client a few more questions. We want this to be as stress-free as possible in terms of the entire exam. So usually in the exam room, you're going to have the client helping you out, and so it's good to make use of them. So I'm going to give Bronson's mom here the treats and ask her to occupy his front end while I can finish the screening exam with him standing. I've already palpated along his forelimbs, his thoracic limbs. Now I'm going to palpate along the spine. I'm feeling the dorsal spinous processes along the entire length of the spine. looking for any areas of pain or tenderness. And then I'm also going to palpate along the paraspinal muscles. We see dogs that have pelvic limb lameness and they're shifting their weight to the front limbs. They'll carry a lot of tension and they'll have trigger points in their latissimus. It's not pathognomonic. You can also have trigger points in the latissimus from thoracic limb injuries. But I definitely want to make sure that I'm checking out the muscles. Again, the latissimus and then our paraspinal, our apaxial muscles here, just along the lateral aspect of the lumbar spine. So we get down to the pelvic limbs, and again, just like the front limbs, I'm feeling for symmetry. And we know that actual muscle atrophy, even subjective atrophy in the pelvic limbs, can be an indication of most likely stifle disease, but it's not, it's not going to be specific for stifle, but it can be sensitive for detecting an injury such as cruciate ligament disease in the stifle. So I'm palpating for symmetry in the muscles, and then feeling femoral pulse. I do feel femoral, I can't help but feel the femoral pulse because I've seen 2 dogs now with clots in the femoral pulse that would definitely show up with a pelvic limb lameness. So now I'm gonna feel for effusion in the stifles, and this is really important. With cruciate disease, the first thing that we're going to see or feel is going to be effusion in those stifles. That's what we're looking for on radiographs as well. Good boy. So palpating just usually to the medial and lateral aspect of the patellar tendon with the dog standing, and then also feeling for medial buttress, just on the inside, the medial aspect of the stifle. And it's much easier to feel medial buttress if you have one side that's normal, one side that's abnormal. Again, always looking for symmetry. Palpate the popliteal lymph node, coming down the tibia, palpating the tarsal joint, again, feeling for any firm swelling. So dogs that have OCD or osteochondrosis in the tarsus, it typically shows up on the medial aspect. And so we'd be feeling for a firm swelling here, and then palpating along the Achilles, and I want to feel for symmetry between one side and the other. And so what Bronson's doing now is he's obviously a very well-trained dog. He knows that when he gets treats, he wants to sit. So I can keep a hand underneath his belly to keep him standing up while I'm doing this part of the exam. So we're going to work in, again, our proprioception. And hopping. Along with the hopping, so one thing that we will incorporate is a strength test where we're testing 2 things. One, how willing the dog is to lift up one leg or let me lift it up. And that is a subjective way of assessing how much weight they're putting through that leg or how the weight is distributed or shifted. So if I pick up his right pelvic limb, I'm just going to kind of assess how hard it was to pick that up or how easy he was willing to give me the limb, and then how he stands on that left pelvic limb before he starts to compensate. And then I'll do the same thing on the right side. So I'm looking at his right pelvic limb, how easy was it to pick up his left one. I'd say that was pretty similar. I'm going to do the same thing in the front. So he's very willing to give me that limb. Let's see the other side. Pretty equal. So I'm not detecting any imbalance in terms of shifting weight from one side to the other. Again, this is a very subjective test, but it is something that I incorporate in. And then the last thing is going to be looking, while he's standing, the last thing is going to be looking at dorsal elevation of the tail and just checking out, especially in older dogs, we want to be thorough in our exam, looking for any masses or anything going on underneath the tail region. So that's essentially the screening exam. And after that, we're going to hopefully have narrowed our area of interest to at least one limb or one joint. And the next thing we're going to do is ask Bronson to lay down in lateral recumbency, ideally. There's going to be many dogs that you can't do your full exam in lateral recumbency like you'd like to, because it's going to be nerve-wracking for them. They're going to be tense. I definitely don't recommend pinning them down on a stainless steel table. I try and do all of my orthopedic exams on the floor. If they're unwilling to lay lateral, you can do a lot of the things that I'm going to show you in lateral recumbency with the dog standing. We're going to pretend that Bronson's right thoracic limb is the limb of interest. The other thing I know about Bronson is that he has allergies and he's very sensitive in his feet. So we don't want to forget about the feet, but we're going to leave the feet to last for each part of the limb exam so that we don't make him uncomfortable with that part. So since I happen to be sitting in this position, we'll start with the pelvic limb. And we're going to be pretty systematic when we go through each leg. Starting, we're going to skip the paw part right now, but when we're evaluating the bones, we're going to palpate along the length of each bone. Now, depending on the signalment of your patient, you may have a suspicion of one area of the bone that you need to pay more attention to, young dog versus older dog, where in the bone the disease process would happen. So metatarsals palpating along here. Now, when we get to joints, we're going to be systematic. So we're going to be checking range of motion. We're going to be checking medial and lateral stability, essentially our collateral ligaments. And we will be feeling for a fusion, but like I mentioned, that's easier to palpate when the dogs are standing. So for tarsal flexion, we're going to flex both the tarsus and the stifle at the same time and assess that's normal range of motion there. I know that's a normal end range or end feel for the tarsus. Likewise, when we test tarsal extension, we need the stifle extended as well. So we'll get to end range of the tarsus, put a little bit of extra pressure on and see if that's any discomfort, and he's nice and stable there, nice and comfortable. So now palpating for the collateral stability in the tarsus, there's medial and lateral collateral ligaments, and there's long and short versions of each. So we need to test for medial and lateral stability in both flexion and extension. So I'll start by extension, and I'm just putting pressure here to kind of break open or put tension on the lateral collateral at this point. So I'm applying a little bit of pressure, testing laterally, testing medially. And now I'm going to flex the tarsus. This one's a little bit more tricky. Again, testing medial and lateral stability there. With an inflection, you're going to get a little bit of rotation. So this one is one that you need to practice. That's going to be our collateral ligament test for the tarsus. Also, again, feeling for any swelling. And we can always palpate our Achilles again, but that's going to be best felt with them standing. Now we've gotten to a bone and some muscle at this point. So we can palpate along the shaft of the tibia quite nicely. You can feel the entire length medially. And if the dog had any sort of stifle surgery, say a TPLO or TTA, you'd be able to palpate the implants on the medial aspect. We also want to palpate the muscles, though. It's important not to only have focus on the bones and joints. We want to palpate muscles. And in muscle palpation, you're feeling for any areas of trigger points or tenderness, any spasms that happen, any areas of discomfort. And this does take some practice to know what normal muscles feel like. So right now I'm palpating his gastroc, essentially his calf muscles. And now we've gotten to the stifle again. Again, we felt for a fusion with him standing. We felt for medial buttress with him standing, but we're going to feel for that again. We're also going to do our flexion and extension, so stifle flexion and stifle extension. So discomfort or pain on end range of stifle extension is one of the earliest signs of a cruciate ligament deficiency because it's putting strain on that cruciate ligament. Even if the ligament is not ruptured or torn at all and they have discomfort, that may suggest a grade 1 sprain. So we apply a little bit of overpressure, normal response. So no response at all is normal. So that's excellent. In this case, I wouldn't necessarily be testing for drawer or thrust because so far I have no indications to suspect that he has a cruciate disease. But for the sake of the video, to do a tibial thrust test, we're going to support the limb. I'm supporting the proximal limb with my proximal hand underneath the distal femur. Essentially my 3 fingers supporting the distal femur proximal tibia. My index finger is going to run down the length of the patellar tendon so that the point of my finger is on the tibial tuberosity, and then my thumb is just gently wrapped around. My distal hand, my index finger generally just runs along the bottom of the metatarsals so that it lies in this little indentation just above the metatarsal pad. And again, I'm supporting the tarsus. Not putting any sort of pressure, just supporting. Now to do the tibial thrust test, what this test is doing is mimicking what happens when the dog walks and bears weight through the paw. We're looking for a cranial displacement of the tibia. And so I want to keep the stifle in a normal standing angle. And so usually it's whatever angle the bottom leg is. And so I'm going to keep that leg in this position, and I'm going to, with my distal hand, apply pressure with my index finger. I'm flexing the tarsus without moving the stifle. That's the key here. So flexing the tarsus without moving the stifle, and I would be looking for my index finger to push forward. Nothing's happening. He's got a very, very stable knee, a very stable cruciate. You can also do this when the dog's standing, especially if they're non-weight bearing or minimally weight bearing. This is an easy test to do with them standing. So that's tibial thrust. Cranial drawer is testing the same thing with the cruciate, but it's a more static test. So my proximal hand, my index finger is on the patella, my thumb is on the fibella, so the lateral fibella, my index finger of my distal hand on the tibial tuberosity, and then the fibular head. So that's going to be our landmarks. And this should not be an uncomfortable test, and it's not one that you need to apply a lot of pressure, dig your fingers in. The mistake that I see a lot of people make is rather than being cranial caudal on the joint, they're medial lateral and putting too much pressure and actually causing some degree of pain. So to do the cranial drawer test, you want to test it in extension and in flexion. A partial tear, you may only get positive cranial drawer and flexion. So usually that's where I start, is I'll be testing cranial drawer and flexion. And so I'm testing it right now. There's no reaction from him. I'm not digging my fingers in. I'm applying some degree of pressure with my distal thumb to try and advance the tibia cranially. So testing it in flexion and then in extension. And then the last thing we need to do with the stifle is test for patella luxation. And the patella is most likely to luxate when the limb is in some degree of extension, not locked out in full extension, but more of a standing angle compared to flexed. So to test for medial patella luxation, I'm going to place the limb in relative extension, internally rotate the limb, and now with my thumb, I've isolated the patella. With my thumb, I'm going to just nudge the patella medially and see if it dislocates or subluxates over the medial trochlear ridge. Nothing happening there. To test for lateral luxation, we're going to do the opposite. We're going to externally rotate and nudge with my index finger, nudging the patella laterally. Just feeling and isolating the patella is step one for this exam. And I know, I completely understand on some of those little dogs, finding the patellas is easier said than done. After the stifle, we'll move up to the hip, again, making sure that we palpate muscles. It's going to be very hard to actually palpate the shaft of the femur. So we can palpate all of our muscle groups. So we've got all of our hamstrings, quadriceps. So the sartorius muscles are an important muscle to become familiar with. Dogs that have cruciate disease, pre or post-op, will get a lot of tightness and trigger points up in their sartorius. So if you don't know where the sartorius is, break out that anatomy book and remind yourself, because that's a good one to palpate. Also palpate our medial muscles here. So when we get to the hip, I like to start by testing hip abduction first. So if a dog has hip dysplasia or hip arthritis, they're not going to want us to abduct or extend the hip. But when we do hip extension, we're also testing for flexibility of that sartorius and our iliopsoas, or our hip flexor muscles. So first I'll start with hip abduction, which is, completely normal here. So no crepitus, no restriction or range of motion. If there is some restriction or some resistance, I'll palpate the pectineus muscle and see if there's any spasms or extra tightness in the pectineus. But that feels great. And so I don't worry about hip flexion. I've never met a dog that has lost hip flexion. So, testing this, I don't bother. But hip extension, we're going to take the hip into extension and try and isolate the pelvis so that we're not also getting spinal extension. So we get hip extension. You're such a good boy. Hip extension, which I would say at this point is actually relatively normal for a dog that may not be completely limber. It'd be like me trying to do a further split than where I am right now. So to test our iliopsoas, we're going to get the hip into extension, and now we're going to apply some internal rotation. So some degree of internal rotation, and right now I'm stabilizing the pelvis in addition to extending the hip, internally rotating. And then I'll take my hand and apply a little bit of lumbar extension. And that would be a reaction that he doesn't love me stretching his iliopsoas. that is no indication that he has an injury of his iliopsoas. It just means it's maybe a little bit tight. So without any other exam findings to suggest that there's lameness or anything going on with this limb, I would not consider that particular reaction to be abnormal. So if you remember, we need to make sure that we don't forget about the feet. So we've looked at his stifle, his hip, checked out his muscles, we looked at the tarsus. Now we want to make sure when I'm looking at the feet, I'm looking at the paw pads. It would be a real shame to miss a laceration, a cut, a burr, anything stuck in the foot that could be a cause of lameness. Now in a golden retriever, especially in a little bit older one, I'm also looking at how much hair he has in between his paw pads. It can be pretty tough for them to stand up, especially on slick hardwood floors, if there's a lot of feathers in between their paw pads. So that's a really easy fix that you can have clients do, is make sure that the paw pads stay nice and trim. So that looks good there. I'm also looking at the nails, looking for any uneven scuffing, any uneven wear. And he's probably not gonna love me looking at his feet much further, but I do wanna check range of motion in the digits. So we'll do flexion and extension. No reaction there at all, but I do usually kind of come back and do one toe at a time. And then palpating the pads themselves. Corns can pop up in dogs. They're pretty uncommon. We see them mostly in greyhounds. But if you palpate on the pad and they're uncomfortable, that could be a corn in the pad. And then lastly, at the metacarpal phalangeal joint, that's a place, it's much more common in the front limbs, but they can get arthritis at that metacarpal phalangeal joint. So you'd be looking for any swelling or any discomfort at that joint. Okay, so that about does it for the pelvic limb. Bronson's being amazing. I'm gonna try and finish this exam from this location. For the sake of video shooting, I'm doing everything from the back, but often I would be sitting on the front side of him and doing this exam, but I think we can get it done from here. All right, so same thing. We're starting at the paw, but skipping it, leaving it till last. So we're gonna look at the metacarpals, palpating along the length of each metacarpal. When we get to the carpus, we're testing range of motion. So normal range of motion of the carpus, the dog should be able to touch their toes to the back of their antebrachium, so that's very normal. Normal extension is a little past 180. So if we have a dog that we're concerned about carpal hyperextension injury, you're actually going to want to test that hyperextension with the dog standing, doing that 3-leg stand. That's going to put the true weight of the dog and see how much they extend. But with them in lateral recumbency, we can put a little bit of overpressure, nice normal end range of motion, end feel there. We're going to palpate the carpal joint again for any effusion, and then we're going to look at medial lateral collaterals, medial lateral stability. So with the leg, with the carpal joint in extension again, applying lateral pressure to test the medial collateral. So I'm just kind of breaking open here, for lack of a better word, kind of applying pressure with my thumbs on the lateral aspect to test the medial collateral, and doing the opposite to test the lateral collateral. So I'm applying pressure on the medial aspect, testing the lateral collateral. And for the carpus, we only need to do that in extension. The flexor carpi ulnaris tendon. So if you can't remember that one, you're not alone, but go back to your anatomy books and check it out. There's a flexor carpi ulnaris muscle and then tendon that inserts right on this accessory carpal pad. And I do see some dogs that come in with a forelimb lameness that they have a tendinopathy or thickening of this tendon here. So get in the habit of just palpating this tendon and feeling what normal feels like. So his is nice and normal. A tendinopathy would feel thickened and he'd feel uncomfortable there. All right, so moving up the antebrachium again. Now when we get to the bones and muscles, we're going to palpate along the shaft of the bone. If we had a dog we were concerned about something like osteosarcoma, we'd pay obviously particular attention to the distal radius. We can palpate the ulna as well along the lateral aspect. And then also palpating the muscles, the flexor group, which is going to be on the medial, caudal medial aspect of the limb. And then the extensor muscle group, which is going to be on the cranial lateral aspect. All right, we get to the elbow. Again, first things first is range of motion. So normal elbow range of motion, they should usually touch their carpus almost to the point of the shoulder. So if you're having a dog that's being reluctant to let you flex their limb, you can take advantage of the normal withdrawal reflex, which is where you just gently pinch a toe and they pull back. So we've got normal elbow flexion here. So carpus is almost touching the point of the shoulder. Apply a little bit of overpressure, no reaction. Elbow extension, so I'm going to support the antebrachium, supporting the proximal limb, and applying a little bit of overpressure now. The heel of my hand is pressing into the olecranon as I apply some overpressure to the elbow here. So dogs with elbow dysplasia, elbow disease, they will usually have some discomfort with that full elbow extension. End-stage or long-term elbow arthritis, they're going to lose range of motion and flexion. A lot of those dogs will get to about 90 degrees. You'll feel crepitus, and they'll be uncomfortable flexing beyond that 90 degrees. There are additional tests of the elbow, but we're going to hold off on those today. Again, those are ones that you could learn in some more specialized palpation courses. So we get up to the shoulder, the proximal limb. So the triceps, remember there's 4 heads of the triceps in dogs. They like to trick us that way. I don't isolate each individual one, but I am going to get in here and kind of palpate the triceps group. This is another muscle group that can get some trigger points or some tightness if they have chronic tendinopathies, chronic arthritis going on. So palpating in the muscle group here. He has actually a little bit of trigger points, a little bit of soreness in his triceps. We talk a lot about biceps tendon, the biceps tendon of origin, but the muscle itself and its insertion down on the medial aspect of the elbow, there can be some compensatory changes or some compensatory pain in the muscle and the distal tendon itself. So I'm going to palpate along the entire length of the biceps. Palpating along the biceps, we feel it up to its origin at the shoulder, and the biceps tendon of origin is at the supraglenoid tubercle on the scapula. And what makes the biceps particularly at risk of injuries, it is a 2-joint muscle, so it originates on the scapula, crosses the glenohumeral joint, and inserts on the radius and ulna across the elbow. The other thing that we'll palpate for up in the shoulder are trigger points. We'll identify where the supraspinatus muscle and tendon are, but also palpating just on the outside of the joint for any trigger points in the deltoids. A lot of times we'll feel them right here, that deltoid. Now we're going to work on range of motion, test range of motion and flexion. And so we want to stabilize the cranial aspect of the scapula as we're testing for flexion and make sure that we've already made sure that they're comfortable with elbow flexion. A common cause for discomfort with shoulder flexion is going to be arthritis or OCD. A lot of times puppies with OCD, you'll get discomfort with that shoulder flexion. Now for shoulder extension, we want to make sure we're stabilizing the cranial aspect of the shoulder, the glenohumeral joint, and extending down, holding at the elbow. And again, stabilizing the cranial aspect of that shoulder is making sure that we're testing the shoulder joint itself. If I let go and stop stabilizing the cranial aspect of the shoulder and just stretch, this is now testing the latissimus. It's testing, stretching more of flexibility. It's important to definitely incorporate this into your exam. We want to make sure we're testing flexibility and range of motion. Many dogs, older dogs especially with compensatory changes from the pelvic limbs, will have tightness in their latissimus. So shoulder extension and shoulder flexibility or latissimus flexibility. Now we're going to come back and palpate the supraspinatus muscle and tendon and put the tendon and muscle on stretch so that we can test specifically that big tendon that inserts on the greater tubercle of the humerus. So it's right on the point of the shoulder there, remembering that the biceps tendon is a little bit more medially. So we can flex the shoulder and apply direct pressure over the supraspinatus tendon. Next, we're going to do the biceps stretch test. And so remembering, we're going to have the biceps originating up on the shoulder, crossing down to the elbow, so it's tethered at 2 ends. We don't expect when we stretch it that we're going to get a perfectly straight line with the elbow joint. If you do, that's actually going to be abnormal. So we want to flex the shoulder and then we're going to extend the elbow. So flexing the shoulder, extend the elbow joint. And now we can apply direct pressure over the biceps tendon at its origin to see if we get any discomfort with that. Many dogs with biceps pain will have pain on both. Now lastly, we're going to want to make sure that we palpate the axilla for any pain or masses, and making sure that we're not feeling anything like a mass or nerve root tumor or discomfort. And I like to cup my hand and kind of reach up in there, so just kind of a nice C shape. And the last part of the shoulder exam is going to be testing for medial shoulder instability. And this test is going to be easier if dogs are sedated, but you can also try it with them awake, and they ideally do need to be in lateral recumbency. And we want to isolate the spine of the scapula and the acromion process, and you're going to want the distal limb to be straight. And so I'm stabilizing the scapula, kind of pushing down against the thorax as I abduct the limb, and there should be a nice distinct end point to that. We're testing the medial glenohumeral ligament and subscapularis muscle. So again, at the very end, the last thing we want to do is make sure we don't forget about the feet. So same thing we did with the pelvic limb. We are going to look between the paw pads, looking for any corns or lacerations, looking at the top part of the paw. Now we're looking at the metacarpophalangeal joint for any swelling, suspicious of arthritis in the toes. You would see swelling, or the dogs may be standing with their feet kind of splayed out if they have arthritic toes, rather than standing nice and up on their tiptoes. So we'll do some range of motion of the toes. I generally start with all of them together and then may do individually flexion and extension. And also palpating the sesamoid, so underneath the metacarpophalangeal pad, right at that metacarpophalangeal joint, the sesamoids. Often overlooked cause of arthritis and pain in dogs is sesamoid disease. And lastly, we're going to look at the toenails, look for any scuffing, and check out the feathers between the toes. In older dogs, we definitely want to make sure that those are trimmed nice and short, because that may be a cause for not being able to get grip on the floor.